All right, let's do it. Let's talk about Meghan Markle. Not Meghan Markle, the superstar, the duchess, the actress, but Meghan Markle, the woman, what she represents to us as women, and what she represents to us as moms, what she was going through, what we observed, and what does it mean for the rest of us? Hi, I'm Dr. Holly MacKenna, integrative psychiatrist here with Dara Wellness in New Orleans. And I saw that interview just like everyone else on Oprah. I had a lot of feelings about it. Before I start, I just want to say I'm not diagnosing anyone. That's not my place. I don't know Miss Markle as anyone other than what everyone sees on the TV or hears about in the news. But something that really struck me when I watched her with Oprah is the level of trauma that she had experienced. And also outside of that, the amount of sadness and struggling that she had and described while pregnant. And then again, after having her baby while she was nursing. This is something I see a lot as an integrative psychiatrist, as someone who treats women. I have a lot of folks come to me talking about the struggles that they had since having their baby or since weaning their baby, because believe it or not, breastfeeding can often be something that keeps us from having things like baby blues and then that more extreme feeling of postpartum depression. So these are things I just wanted to touch on because they're often overlooked, and women have a lot of shame around these things, and that can get really dangerous for both them and their children. So first, that perinatal depression, what Meghan had described as being tearful, having hopelessness, feeling alone, feeling not protected. That's something that someone, when they're feeling so alone and feeling like a lack of support, these are risk factors for depression. Depression during that pregnancy state is actually one of the most common complications of pregnancy, believe it or not. About 10 to 20% of pregnant women can develop depression. And this is something that we really need to be more aware of, because oftentimes these women feel alone. They don't feel supported. They don't feel like they're allowed to have these feelings. It can look like low mood, tearfulness, as we saw with Meghan when she did some interviews around that time, anxiety, real concerns about their baby and how their baby is doing, feeling like they just are really tired all the time or not sleeping well. It could be one or the other, oversleeping or not sleeping enough, not eating well, not able to do things that they normally enjoy in a way that's enjoyable to them. Sorry, I have like a piece of hair that's like bugging me. All of these things are important to know about. And as partners and people who love our pregnant women, we need to be aware of this too. And if you are pregnant and struggling, definitely reach out to your OBGYN, talk to a friend. One of the greatest ways to treat this is to reach out for help, just as Meghan tried to do in that moment. And that's a whole different video about what happened then. Postpartum, she mentioned it in passing, but I don't think people spent a lot of time thinking about it. How Harry came home and she was crying, nursing her baby Archie, who looks adorable. So many times I have women who talk to me about this. I might see them a couple years after they've had their child, and they tell me, about the time my kid was about 6 months or so, I started feeling really down. I started having a lot of anxiety. I started feeling hopeless. I had a really hard time enjoying things. I couldn't sleep when my baby was sleeping. I felt that I was awake at night, worried about all the things and all the bad things that could happen to my child. God bless my sweet mommies. When I asked, at 6 months, were you nursing your child? And oftentimes the time that they stopped nursing is when some of these things come on. Because what people may not realize is when you're breastfeeding your baby, you're making hormone oxytocin, which allows you to bond with your baby. It's an amazing hormone. It's so good. It really does help you feel better. Folks who pump can experience this. I've actually heard of moms who've had a loss who still pump because it helps with kind of getting them feeling better, because it does kind of give you a natural high. So something to be aware of if you're a nursing mom even if you're weaning a year after having your baby or several years, be aware that during that weaning period, you can experience that drop in hormones, similar to what we call a baby blues, where you might feel more tearful, just kind of feel out of sorts, maybe some more anxiety. Baby blues or that weaning blues process, I don't know if there's like an OBGYN term for that. Those things are, I guess, a version of normal in that your hormones are lowering after having the baby. Your progesterone, your estrogen, all those good hormones that kept everything healthy for you while you were pregnant, they lower pretty dramatically once you have your child, because everything that was making those hormones and supporting those hormones, the placenta, the baby apparatus, within your body, has exited. So that leads to that dramatic drop. So that's why we have those blues. But if those blues last more than 2 weeks, 3 weeks max, then we're getting into the danger zone of a postpartum depression, a postpartum anxiety, or the extreme of a psychosis where there's like paranoia or worries about something happening to your child or what have you. So the dangers with postpartum depression, not bonding with your child, not being able to function, crying all the time, like Meghan described, feeling overly anxious, not sleeping when the baby's sleeping, not eating when the baby's eating. Again, ways to treat this, reaching out for help. One of the number one things I do and suggest when someone comes to me with postpartum depression or postpartum anxiety is ask about their support system, because a great way to help a mom who's going through this, whether it be baby blues or postpartum depression or anxiety, is to give them help, is to give them that support, to go in, do the laundry, take the baby for a little bit, let them take a nap, let them do some self-care, let them take a shower. These are things that are super important that we take for granted, but when you're feeling like crap, it can help you turn things around. Now, if things are more extreme than that is able to help, then we talk about entering therapy, talking to someone one-on-one. There's light therapy, there's acupuncture, there's a lot of things we can do with diet. Depending on your breastfeeding situation, there's some supplements, there's different things that we can try. Lots of mind-body practices. There's so much power in your brain. I mean, we really don't give ourselves enough credit with things that we can do to actively rebuild those connections, those pathways within our brain that help us form new behaviors, form new thought patterns, and get us out of that depression. And this is stuff that you often need help to do, and it's okay to reach out for help. That's why folks like myself are here. That's why you have family and friends who love you and adore you and just want the best for you. So if you find yourself in these situations, whether you're a mom who's pregnant or you're someone who's experienced a loss, I've experienced a number of pregnancy losses myself, same hormonal drop, except for you don't have a cute baby there. In a lot of ways, it's worse. So these are things to observe, to hold space for, whether it be with you or someone you love, and to reach out for help. No shame in the game. Reach out. You can reach out to me through my website, darawellnessnola.com, free discovery call if you want to talk about it. Reach out to a therapist, reach out to a loved one, reach out to your pastor, whomever you feel like is a support person or someone you can trust. Do that, because that's the step towards recovery. That's the step towards the light, the step towards being the best you. And with that, I'm going to leave you guys, but I love you. I adore you. And we'll see each other next time. Okay. This is Dr. Holly MacKenna, Dara Wellness. Great to see you guys. Enjoy the rest of your day.